Welcome back to the channel. Today I'm bringing you 100 high-yield Nclex-style MCQ questions with correct answers, rationales, and powerful test-taking strategies. These are the kind of questions that challenge your critical thinking, boost your confidence, and get you fully prepared for exam day. If you're serious about passing the Nclex on your first attempt, stay with me till the end, because each question is designed to teach you how the exam thinks, not just what the answer is. By the time we finish, you'll know exactly how to approach priority questions, safety questions, delegation, pharmacology, and clinical judgment, the topics that make or break the exam. Grab your notebook, take a deep breath, and let's dive straight into these practice questions that have helped thousands of nursing students prepare smarter, not harder.
1. A patient with chronic obstructive pulmonary disease, COPD, has increasing dyspnea and O2 saturation 88% on room air. Which action should the nurse take first? A. Administer prescribed albuterol inhaler. B. Apply nasal cannula at 2 liters per minute. C. Encourage pursed lip breathing. D. Call respiratory therapy. Correct answer, B. Rationale: supplemental oxygen at low flow corrects hypoxemia quickly. Strategy: prioritize immediate physiological needs, oxygenation, before other interventions. 2. A client receiving heparin infusion has platelets drop from 250,000 to 90,000. What is the nurse's priority? A. Increase infusion rate. B. Stop heparin and notify provider. C. Give platelet transfusion. D. Draw coagulation studies. Correct answer, B. Rationale: sudden platelet drop suggests heparin-induced thrombocytopenia, stop heparin. Strategy: recognize dangerous lab trends and stop the suspected offending agent immediately. 3. Which sign most reliably indicates adequate fluid resuscitation in a dehydrated adult? A. Urine output greater than 0.5 milliliters per kilogram per hour. B. Heart rate decreases by 5 bpm. C. Blood pressure rises by 5 millimeters of mercury. D. Skin turgor returns to normal. Correct answer, A. Rationale: urine output reflects perfusion, greater than or equal to 0.5 milliliters per kilogram per hour is an accepted goal. Strategy: use objective hemodynamic measures rather than subjective signs. 4. A patient with acute chest pain is given sublingual nitroglycerin. Which assessment requires immediate action? A. Headache complaint. B. Blood pressure drop from 140/80 to 90/60. C. Relief of chest pain. D. Slight dizziness. Correct answer, B. Rationale: significant hypotension after nitrates is dangerous, stop drug and notify provider. Strategy: monitor vitals closely after vasoactive medications, intervene on unstable values. 5. A newborn is born at 36 weeks and has mild respiratory distress. Which action is appropriate? A. Immediate intubation. B. Provide skin-to-skin contact and dry infant. C. Give prophylactic antibiotics. D. Delay feeding for 24 hours. Correct answer, B. Rationale: for mild distress, thermoregulation and minimal interventions are first line. Strategy: use the least invasive, supportive interventions first for newborns with mild issues. 6. A nurse prepares to give morphine to a postoperative patient. Which finding requires holding the dose? A. Respiratory rate 10 breaths/min. B. Pain reported 8 out of 10. C. Blood pressure 120/70 mmHg. D. Pupils constricted. Correct answer, A. Rationale: RR less than 12 is a common threshold to hold opioids because of respiratory depression risk. Strategy: assess airway/respiratory status before administering opioids. 7. Which client is highest priority for the nurse to assess first? A. Postoperative client 2 hours after surgery with moderate pain. B. Client with chest pain and diaphoresis. C. Client scheduled for discharge today requesting education. D. Client with chronic low back pain asking for analgesic. Correct answer, B. Rationale: chest pain with diaphoresis suggests possible acute coronary syndrome, immediate priority. Strategy: use ABCs and acute symptom recognition to triage. 8. A client on warfarin has 5.5 Indian rupees and is asymptomatic. What is the nurse's best action? A. Give vitamin K per provider order. B. Continue current dose and recheck in a week. C. Hold warfarin and notify provider. D. Administer fresh frozen plasma immediately. Correct answer, C. Rationale: 5.5 Indian rupees is supertherapeutic, hold dose and consult provider for reversal plan. Strategy: for anticoagulant out-of-range labs, hold drug and notify, interventions depend on bleeding risk. 9. Which intervention reduces the risk of ventilator-associated pneumonia, VAP? A. Supine positioning while ventilated. B. Daily sedation interruption and assessment for extubation. C. Change ventilator circuit every 24 hours. D. Avoid oral hygiene to minimize secretions. Correct answer, B. Rationale: daily sedation vacation reduces ventilation duration and VAP risk. Strategy: remember bundle care items that shorten ventilation time. 10. A patient with diabetic ketoacidosis, DKA, arrives with blood glucose 520 mg per deciliter and positive ketones. First priority: A. Give subcutaneous insulin. B. Start 4 regular insulin infusion and 4 fluids. C. Give sodium bicarbonate. D. Offer orange juice for hypoglycemia risk. Correct answer, B. Rationale: 4 fluids and insulin correct dehydration and hyperglycemia, 4 insulin is standard. Strategy: treat immediate metabolic derangements per protocol, fluid first, then insulin. 11. Which lab change indicates lithium toxicity risk? A. Sodium 130 milliequivalent/L. B. Potassium 4.2 milliequivalent/L. C. Calcium 9 mg per deciliter. D. Creatinine 0.9 mg per deciliter. Correct answer, A. Rationale: hyponatremia can increase lithium reabsorption and precipitate toxicity. Strategy: monitor electrolytes and renal function for drugs excreted renally. 12. A client with a chest tube has continuous bubbling in the water seal chamber. Nurse should: A. Document as expected finding. B. Clamp the tube and call provider. C. Check for air leak in the system and connections. D. Strip the tubing to promote drainage. Correct answer, C. Rationale: continuous bubbling indicates air leak, inspect connections and system integrity. Strategy: identify and correct air leaks before altering chest tubes, clamping is risky. 13. A patient on metformin reports decreased appetite and weakness. Which lab should the nurse check? A. Serum creatinine. B. Fasting lipid panel. C. Hemoglobin A1c. D. Serum sodium. Correct answer, A. Rationale: metformin contraindicated/used cautiously with renal impairment due to lactic acidosis risk. Strategy: correlate symptoms with medication adverse effects and check organ function tests. 14. Which action reduces risk of central line-associated bloodstream infection, CLABSI? A. Changing dressings every 7 to 10 days regardless of condition. B. Using maximal sterile barrier precautions during insertion. C. Flushing line with tap water. D. Accessing line with non-sterile gloves. Correct answer, B. Rationale: maximal sterile barrier precautions during insertion reduce CLABSI risk. Strategy: follow evidence-based insertion and maintenance bundles for central lines. 15. A 2-year-old with suspected epiglottitis is brought in drooling and sitting forward. The nurse should: A. Attempt oropharyngeal exam with tongue depressor. B. Keep child calm and prepare for emergent airway management. C. Give oral antibiotic immediately. D. Place child supine for assessment. Correct answer, B. Rationale: manipulation can cause airway spasm, keep child calm and prepare for airway support. Strategy, with suspected airway obstruction, avoid procedures that may worsen obstruction. 16. Which medication is contraindicated in pregnancy? A. Lisinopril. B. Methyldopa. C. Insulin. D. Acetaminophen. Correct answer, A. Rationale, ACE inhibitors, e.g., lisinopril, are teratogenic, contraindicated in pregnancy. Strategy, no key medication classes that are teratogenic or contraindicated in pregnancy. 17. A client develops sudden facial droop and slurred speech. Which action is highest priority? A. Perform stroke scale and call stroke team immediately. B. Obtain a routine metabolic panel. C. Transport to physical therapy. D. Give aspirin immediately. Correct answer, A. Rationale, rapid stroke assessment and activation of stroke protocol maximize treatment window. Strategy, time-sensitive neurological signs require immediate stroke team activation. 18. A patient with congestive heart failure, CHF, has swollen ankles and crackles in lungs. Which med will the nurse expect? A. Furosemide, loop diuretic. B. Metoclopramide. C. Prednisone. D. Propranolol. Correct answer, A. Rationale, loop diuretics reduce fluid overload in CHF. Strategy, match pathophysiology, fluid overload, to pharmacologic action, diuretics. 19. Which sign most reliably indicates increased intracranial pressure, ICP? A. Headache only. B. Bradycardia with hypertension, Cushing triad. C. Low-grade fever. D. Hypotension. Correct answer, B. Rationale, hypertension with bradycardia and irregular respiration suggests increased ICP. Strategy, identify classic vital sign patterns, Cushing triad, for neurologic emergencies. 20. A client with pulmonary embolism is started on low molecular weight heparin, LMWH. Which teaching point is important? A. Use electric razor and soft toothbrush to reduce bleeding risk. B. Stop LMWH if feeling short of breath. C. Increase dietary vitamin K intake. D. Avoid wearing compression stockings. Correct answer, A. Rationale, anticoagulation increases bleeding risk, minimize trauma and bleeding. Strategy, provide practical safety measures for patients on anticoagulants. 21. A patient has sudden loss of peripheral pulses, pallor, and severe pain in an extremity after cardiac cath. Nurse suspects. A. Compartment syndrome or arterial occlusion, notify provider immediately. B. Expected post-procedure pain, document and observe. C. Infection at access site, apply antibiotic ointment. D. Normal anesthesia effect, reassess in 4 hours. Correct answer, A. Rationale, sudden neurovascular compromise post-cath signals vascular occlusion or compartment syndrome. Strategy, recognize and act on neurovascular assessment changes immediately. 22. Which lab indicates risk of malignant hyperthermia during surgery if patient has susceptibility? A. Elevated creatine kinase during crisis, not pre-op. B. Pre-op hyperkalemia. C. Family history of anesthetic complications. D. Low hemoglobin. Correct answer, C. Rationale, family history of anesthetic complications is an important risk factor, CK elevated during an event. Strategy, obtain family anesthetic history preoperatively. 23. A patient with acute bacterial meningitis should receive which priority action? A. Begin empiric 4 antibiotics after blood cultures. B. Wait for lumbar puncture results before treating. C. Give oral acetaminophen only. D. Discharge home with oral antibiotics. Correct answer, A. Rationale, empiric 4 antibiotics should be started promptly after blood cultures to reduce mortality. Strategy, in suspected severe infections, start empiric therapy after necessary cultures. 24. Which finding is expected with Addison's disease, primary adrenal insufficiency? A. Hyperpigmented skin and hyponatremia. B. Hypertension and hypokalemia. C. Elevated cortisol levels. D. Weight gain and edema. Correct answer, A. Rationale: primary adrenal failure causes low aldosterone hyponatremia, hyperpigmentation from ACTH. Strategy: connect endocrine labs and symptoms to underlying hormone deficits. 25. A postoperative patient has a new fluttering sensation in chest and heart rate 150 bpm. Which is priority? A. Assess hemodynamic stability and apply monitor, prepare for synchronized cardioversion if unstable. B. Give metformin. C. Reassure patient and document. D. Increase 4 fluids without assessment. Correct answer, A. Rationale: rapid arrhythmia with high rate requires assessment and prompt treatment if unstable. Strategy: always assess stability, BP, LOC, perfusion, before definitive arrhythmia treatment. 26. Which electrolyte abnormality causes peaked T waves on ECG? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypocalcemia. Correct answer, A. Rationale: elevated potassium shortens repolarization producing peaked T waves. Strategy: link ECG findings to common electrolyte disturbances. 27. A patient receiving total parenteral nutrition, TPN, has sudden fever, chills, and hypotension. Nurse suspects: A. Central line-related bloodstream infection, remove line and start antibiotics per protocol. B. Allergic reaction to lipids, give antihistamine. C. Hypoglycemia from TPN, give dextrose bolus. D. Fluid overload, diurese. Correct answer, A. Rationale: new fever and hypotension in TPN patients suggests CLABSI, prompt management required. Strategy: treat sepsis signs in patients with central lines as potential CLABSI. 28. Which is the best way to prevent falls in hospitalized elderly patients? A. Place bed in lowest position, call bell within reach, and hourly rounding. B. Restrain the patient to bed. C. Sedate all elderly patients at night. D. Keep side rails up at all times. Correct answer, A. Rationale: environmental safety and proactive rounding reduce fall risk, restraints increase harm. Strategy: use least restrictive, evidence-based safety measures. 29. A patient with asthma uses albuterol inhaler and then ipratropium. Rationale: A. Albuterol bronchodilates quickly, ipratropium adds anticholinergic bronchodilation for additive effect. B. Ipratropium is used to sedate patient after albuterol. C. The order doesn't matter clinically. D. Albuterol is anti-inflammatory. Correct answer, A. Rationale: short-acting beta agonists provide rapid relief, anticholinergics provide additional bronchodilation. Strategy: understand complementary mechanisms when multiple inhalers are ordered. 30. A patient with severe pancreatitis has hypotension and low urine output. What is the initial nursing action? A. Aggressive 4 fluid resuscitation per protocol. B. Start vasopressors immediately without fluids. C. Restrict fluids to prevent third spacing. D. Give subcutaneous insulin. Correct answer, A. Rationale: fluid resuscitation corrects hypovolemia and improves perfusion in acute pancreatitis. Strategy: recognize hypovolemia in acute inflammatory states and correct with fluids first. 31. Which is an expected finding in a client with hypothyroidism? A. Cold intolerance, fatigue, bradycardia. B. Heat intolerance, tachycardia, weight loss. C. Hyperreflexia and diarrhea. D. Polyuria and polydipsia. Correct answer, A. Rationale: low thyroid hormone causes slowed metabolism leading to cold intolerance and bradycardia. Strategy: match symptom clusters to endocrine disorders. 32. A patient on vancomycin reports flushing and pruritus during infusion. Nurse should A. Stop infusion and notify provider, possible red man syndrome. B. Give vancomycin bolus faster. C. Ignore, it's harmless and will resolve. D. Increase infusion rate. Correct answer, A. Rationale, rapid infusion can cause histamine-mediated reaction, stop and slow rate, notify provider. Strategy, monitor for infusion reactions and be ready to stop medication. 33. Which assessment shows effective pain control in a nonverbal patient? A. Decreased heart rate, relaxed facial expression, improved activity. B. Increased blood pressure and grimacing. C. Refusal to eat, indicates worse pain. D. Frequent moaning, indicates severe pain. Correct answer, A. Rationale, physiologic and behavioral improvements reflect analgesia in nonverbal patients. Strategy, use objective indicators, vitals, behavior, for pain assessment when self-report not possible. 34. A patient with C. difficile diarrhea should be placed on A. Contact precautions, gloves and gown, and strict hand washing with soap and water. B. Droplet precautions only. C. No isolation required. D. Airborne precautions. Correct answer, A. Rationale, C. difficile spores resist alcohol gels, contact precautions and soap/water hand washing required. Strategy, match transmission-based precautions to organism characteristics. 35. A client with a new ileostomy asks about output color. Nurse should teach A. Expect liquid to pasty green to yellow output initially, normal for ileostomy. B. Expect formed brown stool immediately. C. Expect black tarry stool always. D. Expect blood with every output. Correct answer, A. Rationale, ileostomy output tends to be liquid and may be bile-tinged initially. Strategy, provide realistic postoperative expectations to reduce anxiety. 36. Which inhaled steroid is used for long-term asthma control? A. Fluticasone. B. Albuterol. C. Ipratropium. D. Epinephrine. Correct answer, A. Rationale, inhaled corticosteroids reduce airway inflammation for maintenance therapy. Strategy, distinguish rescue versus maintenance inhalers. 37. A nurse finds a patient unresponsive, apneic, and pulseless. First action. A. Start high-quality CPR and call code blue/activate emergency response. B. Look for advance directive and document death. C. Check blood glucose first. D. Give naloxone intramuscularly. Correct answer, A. Rationale, immediate CPR and activation of emergency response is highest priority in cardiac arrest. Strategy, follow basic life support algorithm, check responsiveness call for help start CPR. 38. A client with rheumatoid arthritis asks about disease-modifying anti-rheumatic drugs, DMARDs. Nurse explains. A. DMARDs slow disease progression but may take weeks to months to work. B. DMARDs immediately relieve pain within minutes. C. DMARDs are only for pain relief. D. DMARDs require no lab monitoring. Correct answer, A. Rationale, DMARDs modify disease course and require monitoring for side effects. Strategy, educate about realistic timelines and need for lab follow-up. 39. Which action reduces pressure injury risk for immobile patients? A. Reposition every 2 hours and use pressure-reducing surfaces. B. Keep the head of bed elevated at 90 degrees always. C. Use only talcum powder on bony prominences. D. Apply moisture barrier only once on admission. Correct answer, A. Rationale, frequent repositioning and specialized surfaces decrease pressure ulcer risk. Strategy, implement prevention bundles for immobile patients. 40. A patient overdosed on acetaminophen. Antidote is A. N-acetylcysteine, NAC. B. Flumazenol. C. Naloxone. D. Atropine. Correct answer, A. Rationale, NAC replenishes glutathione and prevents liver injury when given timely. Strategy, no common overdose antidotes and treatment time windows. 41. When administering blood transfusion, what is critical to check before starting? A two-person verification of patient ID and blood unit compatibility at bedside. B. Patient's appetite for dinner. C. Skin turgor only. D. Room temperature. Correct answer, A. Rationale, two-person verification prevents transfusion reactions from mismatched blood. Strategy, follow institutional transfusion safety protocols strictly. 42. A client with elevated intracranial pressure is placed in which head position? A. Head of bed 30 degrees, head midline. B. Flat supine with head turned to side. C. Trendelenburg position. D. Seated upright at 90 degrees with neck flexed. Correct answer, A. Rationale, slight elevation and neutral alignment promote venous drainage and reduce ICP. Strategy, implement positioning measures that decrease intracranial venous pressure. 43. A patient on warfarin is prescribed trimethoprim sulfamethoxazole, TMP-SMX. The nurse should A. Monitor INR closely, TMP-SMX potentiates warfarin effect. B. Expect decreased warfarin effect, no monitoring needed. C. Stop warfarin prior to starting antibiotic without provider order. D. No interaction exists. Correct answer, A. Rationale, TMP-SMX can increase INR and bleeding risk. Strategy, anticipate drug interactions and increase monitoring when necessary. 44. Which vaccine is contraindicated for immunocompromised patients? A. Live attenuated vaccines, e.g., MMR, varicella. B. Inactivated influenza vaccine. C. Tdap, inactivated. D. Hepatitis B vaccine. Correct answer, A. Rationale, live vaccines may cause disease in immunocompromised hosts. Strategy, review vaccine types before administration to vulnerable patients. 45. A patient in labor has late decelerations on fetal monitor. Nurse should A. Reposition mother, left lateral, give oxygen, stop oxytocin if infusing, notify provider, signs of uteroplacental insufficiency. B. Document and continue routine care. C. Encourage ambulation to relieve decels. D. Administer 4 fluids and discharge home. Correct answer, A. Rationale, late decels indicate uteroplacental insufficiency, immediate intrauterine resuscitation needed. Strategy, follow obstetric fetal distress protocols promptly. 46. Which of the following indicates digoxin toxicity? A. Visual disturbances, yellow halos, nausea, hyperkalemia. B. Increased appetite and insomnia. C. Hypokalemia without GI symptoms. D. Elevated blood glucose only. Correct answer, A. Rationale, digoxin toxicity presents with GI symptoms, visual changes, and hyperkalemia in acute toxicity. Strategy, monitor digoxin levels and electrolytes, assess for characteristic symptoms. 47. A patient with acute stroke is eligible for TPA. Which is an absolute contraindication? A. Active internal bleeding or recent intracranial hemorrhage. B. Onset of symptoms 1 hour ago. C. Age 60 years. D. Hypertension 150/90 mmHg controlled with meds. Correct answer, A. Rationale, active bleeding or recent hemorrhage makes thrombolysis unsafe. Strategy, screen thoroughly for contraindications before administering thrombolytics. 48. Which measure helps prevent catheter-associated urinary tract infections, CAUTI? A. Keep catheter only when necessary and use a septic insertion technique. B. Change catheter daily. C. Irrigate catheter routinely with antiseptics. D. Leave catheter in for convenience. Correct answer, A. Rationale, avoiding unnecessary catheters and a septic technique lower CAUTI risk. Strategy, follow indications and removal protocols to minimize catheter use. 49. A diabetic patient has pale, cool extremity with delayed capillary refill after insulin injection. Which is likely? A. Hypoglycemia, check blood glucose, but signs described are circulatory. B. Local vasoconstriction from inadvertent epinephrine injection, unlikely. C. Peripheral arterial insufficiency unrelated to insulin, assess vascular status. D. Normal reaction to insulin. Correct answer, C. Rationale, pale, cool extremity and delayed capillary refill suggest poor perfusion, assess for vascular issues. Strategy, don't attribute all signs to drugs, evaluate systemically for perfusion problems. 50. Which technique is best for reducing aspiration risk in dysphagic stroke patient? A. Sit upright 90 degrees for meals and chin tuck technique during swallowing. B. Feed rapidly to finish before fatigue. C. Give thin liquids only. D. Place patient supine for feeding. Correct answer, A. Rationale, upright positioning and swallow techniques reduce aspiration risk. Strategy, use positioning and compensatory swallowing techniques when dysphagia present. If you're enjoying this video so far, like and subscribe. Welcome back. 51. Which statement about acute transfusion reaction is true? A. Stop transfusion immediately if reaction suspected and maintain 4-line with normal saline. B. Reduce transfusion rate and monitor vitals only. C. Continue transfusion and document symptoms later. D. Call family to decide what to do. Correct answer, A. Rationale, immediate stop and maintenance of 4-access with saline is critical to manage reaction. Strategy, no emergency steps and transfusion reaction protocols. 52. A patient with COPD is on oxygen, what is a nursing teaching point? A. Use lowest effective O2 flow to maintain target saturations, usually 88 to 92%, in COPD to avoid CO2 retention. B. Always keep O2 at 10 liters per minute for safety. C. Remove oxygen while sleeping. D. Switch to hyperbaric oxygen at home. Correct answer, A. Rationale, high O2 can blunt respiratory drive in COPD and cause CO2 retention. Strategy, teach target saturation ranges individualized to the diagnosis. 53. Which electrolyte imbalance is most associated with tetany and positive Chvostek sign? A. Hypocalcemia. B. Hypercalcemia. C. Hypokalemia. D. Hyponatremia. Correct answer, A. Rationale, low calcium increases neuromuscular excitability causing tetany signs. Strategy, recognize classic neuromuscular signs pointing to electrolyte disturbance. 54. What is the priority when caring for a patient in anaphylactic shock? A. Airway, breathing, circulation, epinephrine IM or 4 promptly. B. Give 4 fluids only. C. Start antibiotics. D. Apply a cold compress. Correct answer, A. Rationale, epinephrine reverses bronchospasm and hypotension, airway support is paramount. Strategy, in life-threatening allergic reactions, act quickly with epinephrine and airway support. 55. Which of the following indicates effective heparin therapy? A. APTT within therapeutic range per protocol. B. INR therapeutic. C. Platelets doubled. D. Hemoglobin increased markedly. Correct answer, A. Rationale, APTT is used to monitor unfractionated heparin anticoagulation. Strategy, know which lab to monitor for specific anticoagulants. 56. A client with major depression is started on an SSRI. Which teaching is essential? A. Improvement may take several weeks, continue medication and report worsening mood or suicidal ideation. B. Expect immediate mood lift within 24 hours. C. Stop medication if side effects appear after 1 dose. D. No need for follow-up, all side effects are minor. Correct answer, A. Rationale, SSRIs often take weeks for effect and can transiently increase suicidal ideation in young adults. Strategy, provide realistic timeline and safety monitoring instructions. 57. Which action helps prevent surgical site infections? A. Preoperative surgical scrub and appropriate antibiotic prophylaxis within 1 hour of incision. B. Delay antibiotics until after incision. C. Shave the operative site with a razor immediately before surgery. D. Use petroleum jelly on incision edges after closure. Correct answer, A. Rationale: timely prophylactic antibiotics and proper skin antisepsis reduce SSI risk. Strategy: follow perioperative infection prevention bundles. 58. A patient on spironolactone shows serum potassium 5.8 milliequivalent/L. Which is priority? A. Hold spironolactone and notify provider for hyperkalemia management. B. Increase spironolactone dose. C. Start 4 potassium chloride. D. Encourage high potassium diet. Correct answer, A. Rationale: spironolactone is potassium sparing, high K+ is dangerous and medication should be held. Strategy: link drug mechanisms to expected lab effects and respond appropriately. 59. Which sign suggests malignant hyperthermia in or? A. Rapid rise in end-tidal CO2, muscle rigidity, hyperthermia. B. Slow heart rate and hypotension only. C. Localized rash only. D. Prolonged bleeding only. Correct answer, A. Rationale: MH presents with hypercarbia, rigidity, and fever, emergency treatment dantrolene. Strategy: recognize perioperative emergencies quickly. 60. Which is appropriate nursing action for a client receiving erythropoietin therapy? A. Monitor hemoglobin and blood pressure, report rapid rises in HGB. B. Decrease iron supplementation. C. Stop monitoring vitals. D. Expect immediate hemoglobin increase in 24 hours. Correct answer, A. Rationale: erythropoietin increases hemoglobin over weeks and can raise blood pressure, monitor labs and BP. Strategy: monitor therapy-specific labs and cardiovascular effects. 61. A patient with left-sided heart failure develops pink frothy sputum. Nurse recognizes: A. Pulmonary edema, urgent intervention, oxygen, diuretics, morphine per protocol. B. Normal sputum for CHF, routine care. C. Bronchitis, give antibiotics only. D. Upper respiratory infection, encourage fluids. Correct answer, A. Rationale: pink frothy sputum indicates pulmonary edema and impaired gas exchange, urgent treatment needed. Strategy: identify key respiratory signs that indicate acute decompensation. 62. Which teaching is appropriate for a patient starting isoniazid, INH, for tuberculosis? A. Take pyridoxine, vitamin B6, to prevent neuropathy, report jaundice or dark urine, hepatotoxicity. B. No need for baseline liver tests. C. Avoid alcohol only while symptomatic. D. Stop medication when symptoms resolve. Correct answer, A. Rationale: INH can cause peripheral neuropathy and hepatotoxicity, B6 prophylaxis and LFT monitoring are recommended. Strategy: teach common med side effects and necessary monitoring. 63. A client on continuous insulin infusion develops sudden hypoglycemia. Nurse should: A. Stop infusion, give 4 bolus of dextrose per protocol, recheck glucose frequently. B. Increase infusion rate to compensate. C. Give subcutaneous insulin. D. Document and observe without intervention. Correct answer, A. Rationale: rapid correction of hypoglycemia with 4-dextrose is essential in ICU settings. Strategy: have hypoglycemia protocols and supplies readily available. 64. Which is a classic symptom of hyperthyroidism? A. Weight loss, heat intolerance, tachycardia. B. Weight gain and cold intolerance. C. Bradycardia and constipation. D. Hyporeflexia. Correct answer, A. Rationale: excess thyroid hormone increases metabolism causing weight loss and heat intolerance. Strategy: correlate metabolic symptoms to hormone excess or deficiency. 65. A patient with chronic kidney disease, CKD, has anemia. Best treatment option often: A. Erythropoiesis-stimulating agent and iron supplementation as indicated. B. Large doses of vitamin C only. C. Oral glucose to stimulate hemoglobin. D. Ignore, anemia is expected and untreatable. Correct answer, A. Rationale: CKD causes decreased erythropoietin. Therapy with ESA and iron can correct anemia. Strategy: understand pathophysiology to choose appropriate long-term therapy. 66. A patient on opioids for pain has constipation. Best nursing teaching: A. Encourage stool softeners/laxatives, hydration, fiber, and activity as appropriate. B. Stop stool softener to avoid dependence. C. Suggest no changes, constipation will resolve spontaneously. D. Recommend opioid dose increase. Correct answer, A. Rationale: prophylactic bowel regimen prevents opioid-induced constipation. Strategy: anticipate and prevent common side effects of chronic medications. 67. Which is the priority nursing action for suspected sepsis? A. Early recognition, obtain blood cultures, and start broad-spectrum antibiotics within 1 hour, sepsis bundle. B. Wait for CT results before starting antibiotics. C. Give antibiotics only after culture results return in 3 days. D. Send home with oral antibiotics. Correct answer, A. Rationale: early antibiotics and source control reduce sepsis mortality. Strategy: follow sepsis recognition and early treatment bundles promptly. 68. Which is a hallmark of anaphylaxis rather than simple allergy? A. Sudden hypotension, bronchospasm, and angioedema. B. Mild localized rash only. C. Itchy eyes only. D. Sneezing and nasal congestion only. Correct answer, A. Rationale: anaphylaxis includes systemic circulatory collapse and airway compromise. Strategy: distinguish between localized allergic reactions and systemic anaphylaxis for urgency. 69. A client receives 4 amphotericin B. Nurse should monitor for: A. Renal impairment and electrolyte disturbances, hypokalemia, hypomagnesemia. B. Hypoglycemia only. C. Increased appetite and weight gain. D. Immediate hair loss only. Correct answer, A. Rationale: amphotericin B is nephrotoxic and causes electrolyte abnormalities. Strategy: monitor renal function and electrolytes with nephrotoxic drugs. 70. Which is true regarding informed consent? A. Provider obtains informed consent. Nurse ensures patient understands and witnesses signature but does not provide legal consent explanations. B. Nurse can give consent if patient asks nurse to sign. C. Consent is not needed for invasive procedures. D. Consent can be signed after surgery. Correct answer, A. Rationale: the provider explains procedure and risks, nurse witnesses understanding and signature. Strategy: ensure consent is informed, voluntary, and witnessed per policy. 71. Which ECG change is typical of hypokalemia? A. U waves and flattened T waves. B. Peaked T waves. C. Shortened PR interval only. D. ST elevation only. Correct answer, A. Rationale: hypokalemia causes U waves and flattened T waves on ECG. Strategy: link ECG changes to specific electrolyte abnormalities. 72. A stroke patient has right-sided weakness and difficulty swallowing. To reduce aspiration risk, nurse should: A. Perform speech/swallow evaluation and implement NPO until assessed. Use thickened liquids and proper feeding techniques as recommended. B. Offer thin liquids immediately to test swallow. C. Feed patient lying flat to promote relaxation. D. Encourage forcing solid foods to build strength. Correct answer, A. Rationale: dysphagia is common after stroke, speech therapy assessment and NPO until safe are standard. Strategy: use multidisciplinary assessments before oral feeding when dysphagia suspected. 73. A client with melanoma asks about prevention of recurrence. Nurse teaching should include A. Sun protection, regular skin checks, and prompt reporting of suspicious lesions. B. No need for follow-up after excision. C. Tanning to build tolerance. D. Only worry about melanoma if family history positive. Correct answer, A. Rationale: UV protection and surveillance reduce recurrence risk and allow early detection. Strategy: emphasize modifiable risk factors and follow-up care. 74. Which medication requires trough level monitoring? A. Vancomycin. B. Metformin. C. Aspirin. D. Lisinopril. Correct answer, A. Rationale: vancomycin troughs ensure therapeutic levels and reduce toxicity risk. Strategy: know which drugs require serum monitoring and timing of levels. 75. A patient with acute upper GI bleed becomes hypotensive and tachycardic. Nurse's immediate action. A. For fluid resuscitation and blood product administration per protocol, notify provider and prepare for possible endoscopy. B. Give oral iron supplements only. C. Wait for stool occult blood test results before acting. D. Place patient on clear liquids and observe at home. Correct answer, A. Rationale: hemodynamic instability from GI bleed requires resuscitation and urgent evaluation. Strategy: prioritize restoring perfusion and arranging definitive diagnostic/therapeutic procedures. 76. A newborn has positive Ortolani sign. Nurse recognizes A. Possible developmental dysplasia of the hip, refer for orthopedic evaluation and possible harnessing. B. Normal newborn finding that requires no follow-up. C. Sign of newborn sepsis. D. A cardiac murmur indicator. Correct answer, A. Rationale: Ortolani test detects hip instability, early detection allows better outcomes. Strategy: screen newborns for common musculoskeletal issues and refer promptly. 77. Which patient education is important for someone starting statin therapy? A. Report unexplained muscle pain or weakness, rhabdomyolysis risk, and avoid grapefruit juice with some statins. B. Stop all exercise to prevent muscle strain. C. Expect immediate cholesterol normalization within 48 hours. D. Take statin only when cholesterol is high that day. Correct answer, A. Rationale: statins can cause myopathy, grapefruit can increase statin levels via CYP interaction. Strategy: teach side effects and drug-food interactions to improve safety. 78. Which is the most appropriate pain scale for a nonverbal older adult with dementia? A. Behavioral pain scale, observational pain tool. B. Numeric 0 to 10 pain scale only. C. Wong-Baker faces only. D. No pain assessment needed. Correct answer, A. Rationale: observational tools assess pain in nonverbal patients using behavior cues. Strategy: use appropriate assessment tools tailored to patient communication ability. 79. A patient with lateral myocardial infarction may have infarct in which coronary artery? A. Left circumflex artery, LCX, commonly supplies lateral wall. B. Right coronary artery always causes lateral MI. C. Pulmonary artery is responsible. D. Lateral MI is not a real diagnosis. Correct answer, A. Rationale: LCX often supplies lateral myocardium, location helps guide interventions. Strategy: correlate ECG leads and MI location to understand affected vasculature. 80. Which sign indicates hypovolemic shock? A. Tachycardia, hypotension, cool clammy skin, decreased urine output. B. Bradycardia and warm flushed skin only. C. Bounding pulses and hypertension only. D. Normal vitals with full pulses. Correct answer, A. Rationale: hypovolemia reduces perfusion causing compensatory tachycardia and hypotension. Strategy: recognize shock patterns and intervene rapidly for volume resuscitation. 81. Which action helps reduce postoperative nausea and vomiting? A. Give antiemetic prophylactically for high-risk patients and use multimodal anesthesia techniques. B. Force early oral intake regardless of tolerance. C. Avoid antiemetics entirely to prevent side effects. D. Keep patient NPO for several days routinely. Correct answer, A. Rationale: prophylactic antiemetics and anesthetic choices lower PONV risk. Strategy: identify PONV risk and apply preventive measures. 82. A patient with osteoarthritis asks about non-pharmacologic measures. Nurse suggests A. Weight reduction, low-impact exercise, heat/cold therapy, physical therapy. B. Bed rest and complete immobilization forever. C. High-impact running daily. D. Ignore symptoms until severe. Correct answer, A. Rationale: lifestyle interventions reduce pain and improve function in OA. Strategy: promote conservative management strategies before invasive options. 83. Which lab indicates acute kidney injury, AKI? A. Rising serum creatinine and decreased urine output from baseline. B. Stable creatinine with high urine output. C. Low BUN and low creatinine only. D. Elevated hemoglobin only. Correct answer, A. Rationale: increased creatinine and oliguria indicate reduced renal function and AKI. Strategy: monitor trends rather than single labs for organ dysfunction. 84. A client with schizophrenia is experiencing extrapyramidal symptoms from antipsychotics. Which med can help? A. Benztropine, anticholinergic, may reduce EPS. B. Increase the antipsychotic dose. C. Start insulin therapy. D. Give an SSRI. Correct answer, A. Rationale: benztropine relieves drug-induced Parkinsonism and dystonia. Strategy: collaborate with prescriber to manage medication adverse effects. 85. A patient with suspected appendicitis has rebound tenderness in the RLQ. This sign is called A. Bloomberg sign, rebound tenderness. B. Murphy's sign. C. Koenig sign. D. McMurray sign. Correct answer, A. Rationale: rebound tenderness, pain on release, suggests peritoneal irritation, often in appendicitis. Strategy: use focused abdominal exam findings to guide diagnostic urgency. 86. Which intervention best reduces delirium risk in hospitalized older adults? A. Maintain orientation, ensure adequate sleep, hydration, early mobilization, and sensory aids, glasses/hearing aids. B. Keep patient in isolation and sedate nightly. C. Hide clocks and calendars to reduce anxiety. D. Restrict family visits to decrease stimulation. Correct answer, A. Rationale: supportive measures reduce delirium incidence and severity. Strategy: use non-pharmacologic interventions to prevent delirium when possible. 87. A trauma patient arrives with open chest wound causing sucking sound. Nurse should A. Apply an occlusive dressing taped on 3 sides, vent dressing, and prepare for chest tube/definitive care. B. Remove dressing and leave wound open. C. Immediately clamp endotracheal tube. D. Give oral analgesic only. Correct answer, A. Rationale: 3-sided occlusive dressing prevents tension pneumothorax while allowing air escape. Strategy: use emergency trauma interventions to stabilize airway and respiration. 88. Which lab is most useful in diagnosing myocardial infarction? A. Troponin I/T levels, cardiac biomarkers. B. CBC only. C. Liver function tests only. D. Amylase and lipase only. Correct answer, A. Rationale: cardiac troponins are sensitive and specific markers for myocardial injury. Strategy: order appropriate specific biomarkers for suspected conditions. 89. Which medication for type 2 diabetes promotes insulin secretion from pancreas and risks hypoglycemia? A. Sulfonylureas, e.g., glipizide. B. Metformin. C. SGLT2 inhibitors. D. Acarbose. Correct answer, A. Rationale, sulfonylureas increase endogenous insulin and can produce hypoglycemia. Strategy, teach hypoglycemia prevention and monitoring when starting insulin secretagogues. 90. A patient with acute renal colic asks about pain relief. Which med is often effective? A. NSAIDs e.g., ketorolac, to reduce ureteral spasm and pain. B. Acetaminophen only, ineffective. C. Antihypertensive only. D. Antibiotics only. Correct answer, A. Rationale, NSAIDs reduce prostaglandin-mediated pain and ureteral spasm in renal colic. Strategy, match analgesic choice to pain mechanism when possible. 91. Which is an early sign of compartment syndrome? A. Pain out of proportion to injury, increased with passive stretch. B. Loss of hair only. C. Delayed capillary refill only. D. Decreased temperature only. Correct answer, A. Rationale, severe pain with passive stretch is hallmark early sign of compartment syndrome. Strategy, act quickly on disproportionate pain after trauma, may require fasciotomy. 92. A patient with HIV is started on antiretroviral therapy, ART. Important teaching. A. Adherence is critical to prevent resistance. Discuss side effects and follow-up labs, viral load, CD4. B. ART works even if doses are missed frequently. C. No need to monitor labs after starting. D. Stop other medications immediately. Correct answer, A. Rationale, strict adherence maintains viral suppression and prevents resistance. Strategy, emphasize adherence strategies and scheduled monitoring. 93. Which is true about rapid insulin, e.g., Lispro, administration? A. Give within 15 minutes before or immediately after meals for prandial coverage. B. Give only once daily at bedtime. C. Use for long-term basal control only. D. It is onset in 6 to 8 hours. Correct answer, A. Rationale, rapid-acting insulins align with mealtime glucose excursions. Strategy, coordinate insulin timing with meals to avoid hypoglycemia. 94. A hospitalized patient requests assistance with spiritual needs. Nurse should A. Offer to contact pastoral care or the patient's faith representative and respect beliefs in care plan. B. Redirect to medical concerns only. C. Refuse to discuss spiritual matters. D. Force participation in a specific religious activity. Correct answer, A. Rationale, spiritual care is part of holistic nursing and supports coping. Strategy, facilitate access to spiritual resources per patient preference. 95. Which finding suggests acute hemolytic transfusion reaction? A. Back pain, fever, hypotension, hemoglobinuria shortly after transfusion. B. Mild itching only hours later. C. Slight fever 3 days later only. D. Elevated blood glucose only. Correct answer, A. Rationale, hemolytic reactions present acutely with pain, fever, hypotension, and hemoglobinuria. Strategy, immediately stop transfusion and follow reaction protocol for acute symptoms. 96. Which assessment is most important prior to administering beta blocker to hypertensive patient? A. Heart rate and blood pressure, hold of bradycardic or hypotensive. B. Respiratory rate only. C. Pain score only. D. Visual acuity only. Correct answer, A. Rationale, beta blockers can cause bradycardia and hypotension, assess vitals first. Strategy, check vital sign parameters specified in med administration guidelines. 97. A toddler ingests a bottle of iron tablets. Nurse recognizes iron toxicity signs include A. GI bleeding, metabolic acidosis, cardiovascular collapse, requires urgent chelation, deferoxamine. B. Drowsiness only. C. Rash only. D. Sneezing only. Correct answer, A. Rationale, iron overdose is life-threatening, early GI symptoms progress to systemic toxicity. Strategy, Treat suspected toxic ingestions emergently and no antidotes. 98. Which intervention reduces postoperative venous thromboembolism, VT, risk? A. Early ambulation, pneumatic compression devices, and pharmacologic prophylaxis per protocol. B. Strict bed rest for 7 days. C. No prophylaxis needed for any patient. D. High-salt diet only. Correct answer, A. Rationale: combined mechanical and pharmacologic prophylaxis reduces VT after surgery. Strategy: implement multimodal prophylaxis for high-risk patients. 99. Which lab abnormality is seen in DIC, disseminated intravascular coagulation? A. Prolonged PT and APTT, elevated D-dimer, low fibrinogen, thrombocytopenia. B. Normal coagulation tests only. C. Elevated fibrinogen only. D. Low D-dimer only. Correct answer, A. Rationale: DIC consumes clotting factors and platelets, causing prolonged clotting times and elevated fibrin degradation products. Strategy: recognize lab patterns indicating consumptive coagulopathy. 100. A patient with depression is started on monoamine oxidase inhibitor, MAOI. Important dietary teaching. A. Avoid tyramine-rich foods, aged cheese, cured meats, fermented products, to prevent hypertensive crisis. B. No dietary restrictions needed. C. Avoid all fruits only. D. Increase caffeine intake to counteract sedation. Correct answer, A. Rationale: MAOIs interact with tyramine to cause dangerous hypertensive reactions. Strategy: provide specific dietary lists and teach signs of hypertensive crisis.
Great job making it to the end of this session. If you completed all 100 questions, you're already ahead of most nursing students. This is how champions prepare for the Nclex. Remember, it's not just about getting the answers right. It's about understanding the rationales, improving your clinical judgment, and knowing exactly how to think on exam day. If today's practice helped you, let me know in the comments, which question challenged you the most? Your comment might be the one that helps someone else studying right now. Don't forget to like this video if you found value in it, and subscribe so you never miss new Nclex practice sets, rationales, strategies, and powerful study boosters dropping every week. Thank you for studying with me today. Keep going, keep believing, and I'll see you in the next video. Your Nclex success story starts right here.